Good morning, gentlemen. Well, it's
Good
actually
morning.
technically afternoon.
Good after morning.
Good after morning.
I don't know.
You got it.
Like we've been talking about, we're following the sun today. We're not meeting after dark. We're doing a midday podcast, which we haven't done yet, so that's kind of cool.
Oh, that's the first.
Travis, thanks for adjusting your schedule and not taking any time off today.
It's all good.
Eating very noisy food that me and Dr. Roy both disapprove of.
I'm not eating anymore. You don't have to hear me crunching on my Gardettos.
I'm just talking about the food itself, not the fact that it's. So let's get right into it. I've gotten some good feedback, and we've got a hard cutoff today, so I want to make sure that we get through all the things that I feel are important. Several good pieces of news here. Dr. Roy shared with me right before we got on, Travis, that Dr. Jack Kruse has been in touch with him, and
Dr. Jack Kruse touched you?
No.
Oh, okay, good.
Show me on the doll where Dr. Kruse.
Dr. Jack, if you heard that, please just ignore Travis. Sometimes it's fine.
Yeah, well, it's pretty much all the time. That's why I'm behind the monitors.
I've been communicating with Dr. Kruse via Telegram in the last 24 hours, and we're going to have a longer discussion at some point because he knows that I'm a physician. He knows what type of physician. He knows that I practiced for 50 years, so he understands all that. And I also told him that I knew the people that he worked with in New Orleans as well, because I spent 9 years in Louisiana and Baton Rouge and New Orleans. Yeah,
and I've been I'm sorry, Dr. Jack, I've been hitting you hard over the head on Twitter because I thought it might be relative to both you and Dr. Roy, the fact that Dr. Roy is a 50-year practicing physician, pulmonary. He's a pulmonary medicine guy. He was basically treated poorly during the whole COVID thing. Became a dissident of the whole narrative. Has been a vaccine advocate all of his career, and even today he's, I think, willing and open to adjust his views on many things. Unlike a lot of physicians that I think that are golden duct taped and golden handcuffed is what me and Dr. Roy talk about a lot.
Yep.
But I feel like there could be a great conversation between a Dr. Jack and a Dr. Roy, because I've heard Dr. Jack talk to a lot of people that are, I would say, closer to what you might say a woo doctor, Dr. Roy. But there's a lot of people you call woo doctors that I still have a lot of respect for. A lot of the reason why I have respect for them is because they're willing to buck the narrative. They're anti-American Dental Association people or anti-American Medical Association people. They still do have a medical license, but they teeter on potentially not having a medical license because they buck the system. They try to take away your medical license just because you didn't, or they threaten to because you didn't agree with the COVID narrative. And it took a lot of courage for you to do that. But for our medical system to come back to life, to people to truly trust it again, we have to allow doctors like you to have dissident views on things and to let the sunlight disinfect it. Now, no pun intended there to Dr. Jack, but sunlight is the best disinfectant.
Right.
And if the best way to kill a bad idea is to put it out there and let smart people say, well, you're wrong because of this, and this. Well,
I've been unhooked from the AMA for 42 years. I quit membership in American Medical Association in 1982 because I just frankly thought they were too far left for me. And
it's crazy that they would even be political.
Yeah.
I don't understand how a medical association should identify as left or right. That doesn't make any sense to me.
Well, and they adopted a lot of things that I didn't like. For example, they were really pushing physicians to ask patients if they had firearms in their house. And it's none of their goddamn business.
Yeah, what does that matter?
Yeah. Well, it's because people supposedly, according to the AMA, people with firearms in their house have a much more likelihood to commit suicide with a firearm or to harm someone with a firearm. I don't believe any of that stuff. I mean, my firearms haven't harmed a single human in 75 years. I've got firearms that are older than I am. I've got firearms that are older than my great-grandfather, for that matter. I've got one that was used in the Civil War. It's sitting in my bird room at home.
So the early bell whistle warning for you of the AMA was partially because they were anti-Second Amendment.
Yeah.
Which is, it's weird that that had to be the thing that kind of awakened you to, they're not always telling the truth here. There's no correlation truly.
In 1982, I was only 2 years out of my training. So, and I was a major in the Air Force. So I was big on the Constitution. I was big on the U.S. Military. So I didn't want to hear them, push down the military or anything else. Don't get me wrong. The military medical system was poor at that time, and it has gotten a whole lot better, but it has gotten a whole lot more woke than it should have.
Yeah. So straight out of the gate here, anyone that's listening, I want to clarify some things. The concepts, the ideas, the conversations that me and Dr. Roy and Travis have on here are, in a lot of times, my opinion, or things that I see patterns and things that are going on. I hear enough people that have told the truth time and time again, saying things. It makes me pay attention to them more. Dr. Jack became one of those people for me. But we need to make sure that everyone always practices informed consent.
Yeah.
Right. So, even if Dr. Roy says something on here, you should always check with your doctor on things. The things we give you on here are not medical advice. And I'm not saying this because I've been threatened by an attorney or anything like that. A person that I know and respect greatly, me and Dr. Roy both know her, is one of those people that she always wants to do her own research. She wants to bounce things off of people, and she wants to whatever. And I think that's what people should do. I'm not trying to say be Dr. Google, but what I am saying is if something doesn't feel right, or if you're seeing patterns. I mean, me and Dr. Roy discovered this very, very early when we started talking in the pandemic, that we were hearing signals from other countries, and we were seeing patterns being expressed from other countries, and those patterns were being deflated and censored here in America.
Absolutely.
Which didn't allow people to get the information that they needed to potentially avoid future harm.
That sounds like North Korea.
No, it wasn't North Korea.
No, I mean, it sounds like, no.
The United States was, yeah.
No, I know, but it sounds like something North Korea would do.
Our government is very good at shining lights on other countries and saying, don't be like these people, don't do this, when in fact they're doing the exact same thing.
Yeah.
And they're just calling it different things. So they're censoring people by just coercing Google and coercing Facebook and Twitter to remove content.
Well, and they have admitted, or at least...
Well, the Twitter and the Facebook
they were forced to admit it.
Facebook have admitted that they were forced to do the things that were told to them by the government.
But no one inside the government has admitted that, and I think that's about to change on January 20th, 2025.
Has any Google rep come out and said anything?
Well, so the Sergey Brin's ex-wife, who has been in close contact with Jack Kruse, Dr. Jack Kruse, she was very entrenched in that whole realm, and she has absolutely come out and spoken about Google, and she's big into she's talking about red light, she's talking about MK Ultra stuff. Basically, she's had her life threatened and everything. I think they were coming after her child, Sergey Brin, who's the head of Google, still she's in peril right now, and Dr. Jack has talked about that a lot. So anyway, I did want to get the informed consent out of the way. Moving forward, the other thing that I do want to talk about a little bit more. Can you see my blue tongue today?
Yeah.
Oh, yeah.
So I'm doing the Troche methylene blue, and I'm talking to this same person that wanted me to mention informed consent. And one of the things that Dr. Jack and Dr. Alexis Cohen have talked about very, very significantly, or not significantly, probably they haven't talked about it enough where I even had that I fully understand it. So I had to dig in a little bit more. But the redox, so the people need to be properly redoxed before they really get into methylene blue to doing it effectively.
Yeah.
And so maybe we should talk a little bit more. I'm kind of putting you on the spot because I didn't say come prepared to talk about redox, but I did come with some information. So what is your, redox is basically all disease, all things in the body happen because of oxidation, right?
Yes.
So that
oxidation or lack of oxidation.
Right.
And what goes on in the mitochondria is the conversion of oxygen into energy, and the redox is reduction of oxygenation. And a lot of things, if you have loose oxygen atoms in your body, they're going to cause problems, and they will reduce the amount of things that your body can do. And that's what goes on in the mitochondria, is the reduction of oxygen into the energy that your body needs, which is mainly ATP, and goes everywhere.
So trying to establish a high redox potential,
yes,
is what Jill wanted me to mention, but also Dr. Kruse and Dr. Cohen have talked about it. So basically what that means is your cells need to be prepared to be fixed. They need to be in their best fixed state. And you and I have been doing things that are naturally doing that. You get out, you exercise every day, you're in the sunlight as much as you can. You've now started doing red light therapy. If you want to put up my screen, Travis, if you haven't already. Mm-hmm. So I've used Grok just to kind of push information together from both Dr. Jack and Dr. Cohen, but basically it talks a little bit about the redox potential, and I don't want to read all the way through it, but to prepare for methylene blue, before using methylene blue, Dr. Kruse advocates for improving your body's redox potential. This involves, he's got 4 bullet points here. Sunlight exposure. He emphasizes the role of natural light in charging our cellular water and mitochondria, which aids in improving redox status. Cold thermogenesis. Exposure to cold can stimulate mitochondrial function, which in turn can enhance redox reactions. Diet. Diet rich in nutrients that support mitochondrial function and electron flow, like those in antioxidants and cofactors for energy production. And avoiding EMF. So you can look over and see Dr. Roy's. He's wearing some special glasses today. I still haven't made him enough money, so mine haven't been delivered yet, but I'm hoping for that sometime soon. But avoiding EMF is reducing exposure to non-native electromagnetic fields, which might disrupt mitochondrial function and thus redox potential. Right. So then methylene blue, once a solid redox foundation is established, methylene blue can then be used as a biohack. And that's kind of a word you might call woo, doc, but no. Okay. So methylene blue, okay. The technical thing here, what it says, and then I'll turn it right back over to you. Methylene blue acts as an electron donor in the mitochondria, potentially enhancing ATP production and aiding in various redox pathways. However, without a good baseline redox status, its benefits might be limited or even be counterproductive if the body is not primed to handle additional electron flow. So I'll turn it right back over to you, but I'll say Thank you, Jill, for bringing this redox thing up, because we're sitting here talking about things. We said, well, here's what we bought, and people should never just go out and start taking it. Yeah. That's what Dr. Roy's here for. You can talk to other people and other experts who are doctors and say, these are the things that you should do prior to, and these are the things that you should look out for. So anyway.
Well, one of the main things that I've been doing is I've been exercising. I take my dog on a hike at least 4 times a week. We go 5 miles. The dog loves it. I love it. It makes me feel better, and I've lost 15 pounds.
Looking very svelte, by the way.
Thank you. I started doing that probably close to a year ago when I retired. I retired.
Semi-retired.
Well, yeah. I actually
taking new patients.
I closed my practice, the brick and mortar practice. I closed that in March of 2023. So we're approaching the second year that I've been doing that. But as soon as I retired, I got out with the dog and started going on. I had a different dog to begin with, and he didn't go as fast as the new one. The different dog was a Labrador, and unfortunately he passed away. But now the one I've got is, I call him a half dingo because he's got the reddish fur that the dingo dogs in Australia have, and but he's got a lot of white on him too. So his mama probably was mated with a dingo.
You have a question, Travis?
I'm going to talk about the EMF thing because there's electromagnetic fields everywhere.
Yeah, there is.
Oh, sure there are.
So
Well,
Your Bluetooth, your
Yeah.
Wi-Fi, the antenna stations that come in for TV, it's all EMF. It all creates any type of electromagnetic. Anything wireless pretty much makes its own electromagnetic field. So I don't know how you're supposed to get away from that.
It's harder and harder. You turn your phones off as much as you can. Put them on airplane, and then you try to reduce the amount of television that you use, the amount of Bluetooth and all those sorts of things.
So the electromagnetic field issue is an issue, and what Dr. Roy says is legitimate, obviously with Bluetooth and all that.
That's what you wear tinfoil hats for, is to keep the EMF from getting in your brain.
But when it's next to my head, though, when it's my phone next to my head, though,
But you should never put your phone next to your head.
Yeah,
Not a cell phone.
talk to it on the
They actually
speaker.
have a use speaker. They actually are. There's one company. I'm not going to plug them. I'm not going to say their name, but they're making no EMF headphones.
Yeah.
So one of the things Dr. Jack talks about is people walking around with headphones in their ears, and it's basically just putting it right up to your head.
Yeah.
And they're making technology now. So one of the big things you talked about, Google and Facebook, I think, own a couple of patents that basically are not allowing other companies to create the screens that would help with the visual side of light, the blue locking side of thing. Now, not from the electromagnetic fields is different, but Google is definitely feeling pressure right now from Nicole Shanahan and from now that there's power in the White House that is looking at this stuff. I think they're going to have to look at things the way they practice business a lot differently.
Sure. One of the things that Dr. Kruse mentioned is cold. And people say, "Oh, well, I don't know about that." And you don't have to immerse yourself in a bathtub full of ice necessarily to get the cold. All you have to do now in southern Indiana is to walk outside, and it's like 23 degrees. You don't have to be bundled up like an Eskimo. You can walk and have plenty of cold out there. And
the goal, and so I'm on a new regimen. You're doing ultraviolet
no, I'm
sauna.
doing
infrared sauna. And I'm doing that 3 times a week. And I've started, today was my second day of doing a cold plunge at 40 degrees. And
40 degrees.
So first day.
That's not very cold.
Yeah. Come on over. Yeah, it's not very cold. You think you're dying. So on Monday when I did it, I thought I was dying like 10 times.
Yes.
Today it was much easier. I did 3 minutes today instead of 2:45, and I controlled with my breathing. I mean, I still thought I was going to die once,
maybe twice.
But I tell you what, and I'm not plugging a company here right now. You feel completely different coming out of it. You
Probably a jolt to something in your system.
There's a lot of different things that it does.
When you go out walking, I mean, last week it was like 16 degrees outside, and it was pretty chilly. The dog didn't have any problem, and I stayed nice and cool.
Mm-hmm. Well, you can get it. So that is part cold therapy. People are also taking cold showers, especially this time of the year.
That's what I used to recommend to my patients is once a week, take a cold shower, and just the way it comes out, turn off the hot water, and the way it comes out, take the cold shower.
So the once a week thing, what I'll say is the newest content that I'm seeing is they're recommending 11 minutes per week. Mm-hmm. And so I'm doing cold plunging. I want to get up to 3-4 minute blasts per week is my goal.
The guys that I recommended taking a cold shower to were marathoners, and they both agreed that. So one of them, whom I'm meeting later today, said every week he takes a cold out of the wall shower for 10-15 minutes.
Yeah, so Dr. Jack talked about thermogenic. So that's one. He also talks about red light therapy. More important, if you can get in the sun right now. Here in Indiana, we're not getting a lot of sun right now. No. So I'm supplementing definitely with red light therapy as well. But the other pieces of it is, I think we've got our redox. You and I have our redox potential covered. The other thing that's really interesting when we're talking about methylene blue is there's all kinds of different things being talked about and what it does. There's several books out. I have one. I think I left it down at our lake cabin. There's a book called The Magic Bullet, and then I was just recommended another one that I'm going to purchase here, and I'm trying to get a clip, so I apologize. But two of the people that we listen to quite a bit, I share a lot of clips with. Dr. Roy is Brett Weinstein and Heather Hying. And so apparently Heather and Brett's son was in Italy, has been for some time traveling. And he flew back and he was fine. Apparently got sick on the plane and exposed Heather to it, and Heather got sick. And so I'm going to play this clip real quick because this is the first time I've heard anything like this from them. And you and I have talked about whether he pays any attention to what Dr. Jack's saying, because he's never referenced Dr. Jack straight away, but now he's talking about a lot of the things that Dr. Jack is. So listen to this clip.
Hey folks, welcome to the Dark Horse Podcast, live stream number 255, if I'm not mistaken.
You're going to see some quirkiness here.
I am Dr. Brett Weinstein. You are Dr. Heather Hying. Not a normal show. You are feeling a little under the weather as a result of a series of events in which our son left his spot in Italy to come home. He became sick in transit, and I would point out, as I pointed out at the beginning of COVID, that there's no guidance on exactly what you're supposed to do. What was he going to do other than just complete his travel home? But anyway, he's come home sick, and several of his friends that he was hanging out with apparently also became sick in their travels. And anyway, you seem to have caught it. I think you're doing great. He was pretty sick. You're on your feet.
Not entirely helped by you forcing me to drink textile dye.
All right. Well, in my defense, this particular textile dye is
my tongue is still
blue.
I'm going to try not to open my mouth much, but
your tongue is still blue.
From my teeth.
Which skinks.
It skinks.
Skinks, not skanks.
I said skinks.
Okay, skinks.
I'm talking about skanks.
Right.
Well, herpetologist.
Frog
man.
protection, like
There are no
same thing.
skanky skinks.
No, but there are blue-tongued skinks. Yes, there are blue-tongued skinks.
Mm-hmm.
And I would point out that the textile dye, which I administered in good faith and in the hope of improving your situation, caused some technical issues with the podcast.
Oh, did they?
Yeah.
How's that?
Well, it caused a Bluetooth problem.
That was awful. That was terrible.
I mean, look, how many times in life is the universe going to set you up for that joke?
Never, but it's apparently going to set you up once.
Once.
Yes.
Once. And so what was I going to do? Pass it up? You know.
Not you.
Right, exactly.
No, sir.
So I shared that for a couple reasons. First of all, you don't see their humor very often.
Yeah,
I think you heard my eyes roll when he said that. Like,
it sounded like billiard balls.
What is it?
when your eyes roll?
What does a doctor who's an evolutionary biologist make a joke? That's his Bluetooth joke.
Yeah.
How very techie.
good thing he's not a comedian.
He is not.
That's right.
For somebody that listens to him a lot, it was really funny for him. But so I wanted to share that mostly because he's talking about the use of methylene blue.
Yeah.
Which I thought was very interesting because I've never heard him talk about it. He's, as far as I know, I listen to most everything that they put out, at least the clips, and now I'm waiting for.
It was so funny. She said, "You forced me to take
Textile dye."
Textile dye, and
he called her a skank, a blue-tongued skank.
Skink.
Oh,
Skink.
well, okay.
Skink is.
I know what a skink is.
Yeah,
Yeah.
we got a lot of those on our deck.
Yeah.
So anyway,
You find those when you go snipe hunting. No, I'm just kidding. Go snipe hunting, everybody. Look that up.
I actually killed a snipe on a snipe hunt one time.
Did you?
Yeah, they're little birds. Have a long beak.
Okay.
So the other book I've been referenced to purchase. I'm going to get the audiobook and the written word because that's the only way I learn because I'm a little bit dense. But so the other one is called The Ultimate Guide to Methylene Blue. Remarkable hope for depression, COVID, AIDS, and other viruses, Alzheimer's, autism, cancer, heart disease, with ... targeting mitochondrial dysfunction. So
what bothers me is anytime someone comes out with one thing that cures
it all?
That cures it all.
The magic bullet?
I immediately go, whoa.
Okay. But
Yeah.
you and I have talked about the magic bullet.
Oh yeah,
Okay.
it does have some help, but it's not going to cure AIDS. And
You mean if Freddie Mercury took it, he wouldn't still be here?
I think at this stage of the game, Dr. Roy, I would hesitate to be so 100% sure on everything.
I'm not 100% sure.
I just
on
think
anything.
I don't trust anything that I've heard from most of medicine and most of dentistry now at this point.
Yeah.
And I want to be proved wrong. That's why we're doing this conversation. I've reached out and I think I've got another dentist who's retired who's going to speak to me or speak to us. So I'm really excited about that. Mm-hmm. So we can go in several different directions here.
Talk about your mouthwash?
Well, I got some clips that I want to share. Can you see that in the frame? I don't know.
You can if I put the room on.
Okay, so it doesn't really matter. We'll just save that one. I shared something with Dr. Roy this morning, and he automatically he thinks I'm going off the woo end again.
Every time you say woo, I just think of who are you? Like, who are you? From,
we think of it as cool. Yeah. So I want to keep the friction between what Dr. Roy calls woo and what keeps me. I keep finding things out there that sound so interesting that I can't ignore them. And and I said something about this promise of this book is how methylene blue can help with all these different things. And Dr. Roy was automatically like, no. Okay, so somewhere in between there's truth.
Yeah, the one that got me was AIDS.
That is when he started laughing. That's why I brought up Freddie Mercury.
AIDS is not a killer anymore. I mean, it's a chronic disease just like diabetes.
It apparently never was if you had money.
Well, yeah.
Well, no, I guess Freddie had money, but Magic Johnson somehow came out of it unscathed.
Well, there's some question as to whether Magic really had it.
Oh.
Yeah.
So I think I'm going to pivot right into this. Kind of goes to the same thing we've been talking about because I've watched a couple of podcasts and started following a couple different doctors who are actually dentists. And Dr. Roy, I want to flesh this out with you a little bit because as I'm thinking about having a conversation with a local dentist who's retired, who might be open to some of these fluoride discussions, I want to give a little bit a little bit of background and let you hear this doctor, and you can make your own assumption of what he's saying.
Patients actually got worse compared to the placebo.
That's not what I want to start. I don't think. Sorry, Travis.
Nope, I came back to you, bub.
Still not there.
Do you think that if we boost our nitric oxide in the body, that is a way to fix all brain disease?
I not only believe that, I know it from the scientific literature. Yeah, Joe Biden is the poster child for nitric oxide deficiency.
Dr. Nathan Bryan.
He's an expert in nitric oxide who has spent 20 years researching how this miraculous molecule will save you from heart attacks, strokes, and Alzheimer's.
And it starts with what's in your mouth.
Every single chronic disease, it doesn't matter if it's autoimmune disease, Alzheimer's, cardiovascular disease, diabetes, all of those result from the primary loss of the production of nitric oxide. To me, it's no wonder why Americans are the sickest people on the planet, because everything we do in a Western lifestyle, whether it's Western medicine, Western diet, drug therapy, all disrupts nitric oxide production and leads to chronic disease.
So, mouthwash, it's not good.
Antiseptic mouthwash destroys the microbiome, decreases nitric oxide production, causes high blood pressure, which is the number one risk factor for the number one killer of men and women worldwide. And it's not just antiseptic mouthwash, it's fluoride. Go look at your toothpaste now, and if it has fluoride in it, read the back label. And it says, if you swallow this, contact poison control. What? Because fluoride is a poison.
Let's talk about the 6 ways to naturally increase your nitric oxide.
So I tell people the first thing you do to restore your nitric oxide production is to eliminate the things that are causing a disruption. People who've been on PPIs and antacids for 3 to 5 years have a 40% higher incidence of heart attack, stroke, and Alzheimer's. Because if people understood and really knew what these drugs were doing to them, no one in their right mind would take them. No one.
This episode with Dr. Bryan.
Okay. I'll let you respond out of hat if you want on that, Doc. I know I'm hitting you. I don't think I shared this video with you yet, so you're going to see this probably for the first time.
I've heard all this shit for the last 5 years.
Okay.
You know, that statins cause dementia and that PPIs cause heart attacks.
And you and I have hit back and forth on this a little bit, where you said potentially in your opinion can be changed because you're a flexible guy.
Sure.
Your brain plasticity is still allowing you to have conversations. Maybe there's a window to justify statins, but how quickly and what can we do to potentially mitigate and not have to do them? You talked about, as we get older, maybe we'd come off of them if it does have an effect on Alzheimer's. Mm-hmm. What this video gets to is if we can simply improve the nitric oxide that we have going on right now, we eliminate the need for cholesterol medication. We eliminate the potential of put eliminate in. I'm not saying it's a cure. I'm not saying that. What I'm saying is they're saying there's enough evidence to say if we focus on getting rid of the shit that doesn't allow natural nitric oxide production, optimal nitric oxide production, then let's start with that. I'm always a root cause guy. Let's, if you're about to die, then talk to Dr. Roy and take the medication that's going to have you not die. Yeah. And then let's talk about the things that we can do to get you more apt of not needing the pharmaceutical cure. Right?
That's right.
Okay.
And, the fact that people develop cholesterol plaques in their blood vessels is one thing, but a lot of that is genetic. And you can't pick your family tree.
No, but you can work on your cholesterol, though.
You can work on your cholesterol, but some people who have genetic high cholesterol, you could feed them lettuce salads with no dressing 3 meals a day, and they would still have cholesterols above 300. So then you have to figure out that those are the people that probably need statins the most.
Okay.
Compared to the people who have a cholesterol of 220 and are overweight and are eating donuts every morning, those people need to change their diet rather than getting put on statins right away. Statins, I've been on statins for 10 years, so I got on it late, and I really decided a while back that I didn't need the statins anymore, simply because, you know, the cardiologists will say the lower the cholesterol, the better. There are some points where lowering the cholesterol makes things worse.
Yeah, there's a clip in here that hits on that specifically.
It boosts your risk of cancer, actually.
Especially in an age where turbo cancer's hitting people upside the head pretty hard. That's not a good thing that you want to compare.
Not really. So I actually quit taking statins a while back.
How long ago was that?
That was about 4 months.
Okay.
And
I'd like to think that some of our conversations made you reevaluate some of that. And I also want to have that conversation with you and air that out, because my dad is on statins.
Sure.
He's worried about Alzheimer's. And so we're trying to get him dialed in like we're dialing you in. Here's what you should do. And we can get you off statins because there's some Alzheimer's risk in that.
There's Alzheimer's risk, but if you stop taking your statins and you have a high cholesterol, that makes your cardiovascular resist work.
So let's keep working through that.
There are two types of dementia that are forward in the United States. Alzheimer's is one, and the other one is vascular dementia. You destroy all the tiny blood vessels in your brain, and it causes dementia. And Alzheimer's is ahead in this race, but there are more and more people who develop dementia from their vasculature.
And then Parkinson's, I'm hearing more and more about that too, seemingly. I think when I saw, what's the actor that got it?
Michael Fox.
When he got it, I hadn't really heard of it a lot. I think he got a lot of exposure. Yeah. And
I've had two colleagues of mine who were in medical school the same year that I was, who were nice guys and thin, active, all that sort of thing. And they both died of Parkinsonism. And one was an anesthesiologist and one was a, researcher, I think. But both of these guys died, and they died like 10 years ago.
What are the four hallmarks of chronic disease?
Sorry. You keep going, Doc. I'm just trying to cue something up. I didn't put the mute button on, right?
Jack and Bill, they both died very young. I mean, 10 years younger than me now. I'm 75, and they died before 65.
Well, let's get right into these clips, because we're trying to solve some of these problems. Go ahead, Travis.
Just real quick, I'm real interested. So what did you hear about Parkinson's? Like, what about Parkinson's what are you talking about?
I don't have the specific thing.
I think he was talking about there being more Parkinson's these days.
Oh, just
because of mitochondrial dysfunction that we have going on in general disease.
There's a type of dementia that looks like Parkinsonism. It's called Lewy body dementia. And the way you diagnose that is that they have the tremors of Parkinsonism, but they also have the dementia.
That's what Bruce Willis has, right?
Yeah. No, he has a different type.
Similar,
He's
but
got
different.
the frontal lobe dementia.
Okay.
Yeah, because he can't speak at all.
Gotcha. I'm sorry. I'll come back to that now that you've asked me more about Parkinson's.
No, it's okay. It's in my family. And the other thing I was going to ask, Doc, would cholesterol be called something else in like a CBC or like a metabolic panel? Like what would it be? It would just be called cholesterol?
Yeah.
It wasn't in any of my tests.
There's an HDL and an LDL cholesterol.
And you're going to hear one called good and one called bad.
And the thing about it is the bad one is not all bad.
Yeah.
And the good one is not all good.
They're both required for brain health. They're required.
As a matter of fact.
Yeah.
So, they are.
But anyway, so this is where I think the narrative is changing, Dr. Roy, and even you, the way you describe that, I wouldn't have expected a normal medical doctor to say that 15, 20 years ago.
No,
they're going to tell you, they're going to
cardiologist-
say, this is bad and this is good and you got to do this or that.
That's the cardiologists. You know, all they think about is, me take care of heart.
All right, I'm going to get into this clip because we got a bunch of them and this is fantastic.
What are the 4 hallmarks of chronic disease? And how does it all trace back to nitric oxide?
Now, look, that's a fundamental question that we've been after, really medicine's been after for the past 100 years. And unfortunately, Western medicine is kind of siloed into these so-called specialists, right? But if you look at the hallmarks of every single chronic disease, it doesn't matter if it's autoimmune disease, Alzheimer's, cardiovascular disease, diabetes, there's 4 fundamental problems. Number 1, there's reduced blood flow to that organ. In dementia and Alzheimer's, there's reduced blood flow to the brain. In ischemic heart disease, there's reduced blood flow to the heart. In sexual dysfunction, there's decreased blood flow to that organ. And the consequences of that is you get inflammation, oxidative stress, and immune dysfunction. So the low blood flow, inflammation, oxidative stress, and immune dysfunction are hallmarks of every single chronic disease. Now, where does nitric oxide play a role in that? Well, when your body loses the ability to produce nitric oxide, it constricts the blood vessels and restricts blood flow to that particular organ. And then you get an upregulation of adhesion molecules, which is what we call vascular inflammation. That's when you start to get the immune dysfunction. The immune cells start to extravasate outside the lumen of the blood vessel and elicit this oxidative stress. And then there you have it. You have reduced blood flow, you have inflammation, oxidative stress, and immune dysfunction, and that explains every single chronic disease. And all of those result from the primary loss of the production of nitric oxide.
So a good question would be...
Okay. So, Travis, this kind of answers your question because you're thinking Parkinson's is something way different than maybe Alzheimer's or whatever. It's all based off of your body is going to react, and certain people are going to get certain things with genetics, and other people are going to get other things.
The inflammation is one of the most important ones because if you have inflammation in your body, which goes back to the nitric oxide, if you have a lot of inflammation, then you're going to be more at risk for things like Parkinsonism, for dementia, and for autoimmune diseases. Now, autoimmune diseases didn't exist when I was a medical student, but we had an awful lot of diseases that we had no cause for. And I think the first one to be discovered as an autoimmune disease was underactive thyroid. That's called Hashimoto's thyroiditis. Now, they didn't discover that it was Hashimoto discovered it in the 1920s, but we didn't discover that Hashimoto's thyroiditis was an autoimmune disease until we got the ability to come up with the antibodies, and we found out that people with autoimmune disease, autoimmune thyroiditis, have 2 different autoimmune problems, and you can figure out which one they have or figure out if they have both of them, and that tells you that you can that you need to give them more thyroid replacement. So anyway, but a lot of other diseases have been found to be autoimmune as we go along.
Okay, so here's where I think my brain always tries to go, Dr. Roy. And when you said what you said about methylene blue and the fact that it potentially cures all that, simply, and I know...
I never said that it potentially cures
No.
all that.
I think you pushed back that it absolutely couldn't, but here's what I'm getting at. I always go say, and we say there's an uptick of 20 different metabolic related diseases that all happen simultaneously.
Yeah.
To me, there's a root cause issue there.
Sure.
And
the root cause is probably nitric oxide.
Yes. And is nitric oxide a problem because of diet? Yes. Is nitric oxide a problem because of oral hygiene and care? Yes. So these are the things, to me, again, if you and I are going down this path of saying what's good, saying what's bad, I've had a problem with statins, you've used them, and now you're tweaking your model on how you use them. That's just the way medicine is supposed to be. That's why I'm so impressed with you, because you've been practicing medicine for over 50 years. You should be as strict on, well, this is the way it's always been done or whatever, but you're not. No. So this is what we're trying to talk to other doctors about. Like, people have to be able to explore these different things. And you may listen to this podcast and at the end of it say, well, they're full of shit. Or you may say, there's several really good points in there that I hadn't really put two and two together, and they've organized it in such a way that this could be used as education for people. Like, go watch this video. I'm going to share the clip, watch the whole thing, and just listen and say, do I believe this? Why am I not hearing this from my normal medical doctor? That's why you're here. Yeah. That's why you're here, because you are a medical doctor.
In the 50 years since I started, since I finished medical school, I started medical school 54 years ago, almost 55. Things have changed at least 3 times, if not more times, on what we thought about. Some of the diseases that we learned about in medical school were treated in one way in the 1970s, and then by the 1980s, we never treated them with the same medications.
So you weren't bloodletting anymore?
No,
he still recommends that sometimes.
Does he? Leeches and things?
We actually do. We still do leeches.
Oh yeah,
and we still do maggots. So don't give me any crap on that. We're still,
I was just asking about bloodletting and leeches. I wasn't giving you crap.
I've given him crap in the past.
Well, we don't necessarily. We've phlebotomized people because they need it. There's one disease that phlebotomy is, which is the removal of blood periodically. That is the one and only cure that we have for that, and that is, elevated iron in the body. Hemochromatosis.
Yeah, you brought up a lobotomy. When is that ever actually needed?
The lobotomy?
Did you say something about, or did you say phlebotomy and I just misunderstood you? Okay.
Yeah.
Very different.
Yeah, very. But they sound very close.
Yeah,
it is it's removing something.
No, I know what a lobotomy is. That's why I thought, I was like, you still do that?
The guy that brought the lobotomy about actually won the Nobel Prize for that. And they took his Nobel Prize away from him after he had died.
Wasn't there a Kennedy? Was it one of Kennedy's sisters or something?
Yeah, one of the Kennedy's sisters had a lobotomy, and she came out as a vegetable, and that can happen. Now, I had I don't know whether it's the honor or the problem to talk to a few people who had lobotomies, and they could talk to you, but they didn't make any sense when they talked to you.
But anyway,
sorry, we went down a weird hole.
That's a very deep rabbit hole.
We went.
Let's get away from.
I heard lobotomy and I wondered what the heck.
Yeah,
anyway. You didn't hear it. You thought you heard it.
Well, yeah.
But what I was trying to say is that the way we treat diseases has changed at least 3 or 4 times in the last 50 years. Because I'll tell you one particular drug that was commonly used in the 1970s to treat heart disease was digitalis. We never use that anymore. We quit using it in the 1980s because it frankly doesn't work. We use other things that have no relationship to digitalis that will help decrease the amount of strain on your heart and decrease the problems of congestive heart failure.
Is nitroglycerin still on the list? Do you still use nitro?
Yeah, I still use nitro, but we use different forms of nitro.
My grandfather used to carry a little vial with little nitro.
Yeah, little tiny. Did you ever have the thought of putting one of those in your mouth?
Not at all.
Don't ever do that. You will get the worst headache of your life.
Oh.
They used to use nitroglycerin paste on the patients, mainly at the Birmingham VA. And you'd go in there to examine one of them. You would get the nitroglycerin paste on your fingers and immediately get a terrible headache.
Huh.
I did that one time and then stopped, you know.
I'm going to get a button that I can push that it's just going to say rabbit hole, and it's going to say rabbit hole, and I'm going to unpush it whenever we get out of the rabbit hole. So
we're out of the rabbit hole.
We keep
now.
going.
We're done.
We're just whoa.
Yeah.
So anyway, there's another clip here. I want to keep going through these clips again. So here's the thing. Dr. Roy is a 50-year practicing physician. He's done things basically standard. I don't want to say standard of care because that's a bad word to me at this moment. But you've done things based on your experience. You've done things based on what you've seen in the real world and what other doctors in your community have done.
There were some times where I created the standard.
Well, that's fantastic. We need to get in that in detail. That is a rabbit hole right now that I don't want to dig into. Where I think Dr. Jack, to me, when I first brought the clips to you, I saw something in you that I hadn't quite seen yet. And that was more of a rapid transition of, this makes such logical sense to me that I have to believe it at some level. And I think that's where I am. So we got to get through what he is saying and what Dr. Cohen are saying. And if it really is a root cause fix for a lot of things, we can't ignore it. Similar to this nitric oxide story. But let me get right back to this clip, because all these things will tie together. And a lot of the things she asks and a lot of things Dr. Nathan Bryan say do align with what Dr. Jack is saying.
Sure.
Why do we lose nitric oxide as we age?
Well, if you look at so there's two primary pathways where we produce nitric oxide.
All right, sorry about that, guys. We had a technical glitch, and it happens. That's what when you're trying to do everything all at once. Let's
nitric oxide.
Get right back into it.
So a good question would be, why do we lose nitric oxide as we age?
Well, if you look at so there's two primary pathways where we produce nitric oxide. And if the first pathway to be discovered was through an enzyme called nitric oxide synthase, and this enzyme is found in the neurons in the brain, it's found in the lining of the blood vessels. But if you look at population-based studies, the older we get, the less nitric oxide we make through that enzyme. And we call that endothelial dysfunction. So on average, the average American is losing about 10 to 12% of their nitric oxide production per decade. And this starts in the late teens, early 20s. So then by the time we're 40 or 50 years old, we only have about 50% of the nitric oxide we had when we were younger. And today we understand that we can shift this to the left. We can accelerate that loss, or we can prevent the loss. But the rate limiting step in that loss of nitric oxide production is due to oxidative stress. We oxidize a molecule called tetrahydrobiopterin, and then we uncouple the NOS enzyme, and we lose the ability to produce nitric oxide upon activation or stimulation of that enzyme. And it's kind of this perpetual feed forward cycle, because if we can maintain normal nitric oxide production, we prevent the oxidative stress that leads to a loss of nitric oxide production. So what leads to that? Well, it's really the Western lifestyle. It's a Western diet, or the standard American diet, the SAD diet, we call it. It's lack of physical activity. It's exposure to toxins, cigarette smoke, if you smoke, environmental toxicants. And, we live in a toxic world. We're under a lot of stress, oxidative stress. And eventually that leads to a downregulation of nitric oxide production. And it's a high sugar diet, which, is a major, major problem, because sugar sticks to the enzyme, not just the nitric oxide synthase enzyme, but other enzymes, and makes them inactive. And then
So just to hit on this, because we keep talking about our diets that are causing problems, and we don't say it anecdotally, because a lot of people are talking about it, and there are studies that show it. But again, so whenever you start breaking it down and hearing clips like this, to me, the pieces start to align. Like, it just makes so much logical sense.
Yeah.
We're talking about diseases of age, and we're talking about, trying to prevent any Alzheimer's in you, trying to prevent any Alzheimer's in my dad and my other older family members who are predestined potentially through family, is if you look at our behavior and what we're putting into our body and the things that we're doing, we can't get so fixated on a miracle cure or drug for Alzheimer's. It's a root cause thing. It's a problem that comes through the lack of nitric oxide in our body. And what can we do to lift those things up? Dr. Jack is hitting on that very, very great.
Sure.
You know what I just found?
What'd you find?
To help with that nitric oxide, to increase that nitric oxide, you know what you can do?
What?
Drink red wine.
Red wine.
I swear to God, it's right here. Some studies have found that moderate consumption of red wine can increase nitric oxide levels.
Well, the European diet, the Mediterranean diet.
There's a lot of red wine in there.
There's a lot of red wine there.
That's true.
Not as much, and the breads that they do eat are fresh. They don't have any of the added chemicals in them to hold them for 5 days or 2 weeks or 3 months. Everything's fresh. They eat stuff out of the ocean. So it's a Jack Kruse great white diet.
See, I have a little list here, like beets, oranges and grapefruits, watermelon, pomegranates, spinach, cabbage.
Beets are great, and they have several things that can come out of eating beets. Above and away from creating the nitric oxide, it gives you some things to look out for in the toilet, because you'll have sort of bright red stools.
So do I need to have a button for the rabbit hole, like a or something? Do I need to
something like that? All right, I'm gonna keep cracking through the clips here, because they're going to hit a lot of what you talked about here, Travis.
Excellent zero-cost way to naturally increase your nitric oxide is through deep nasal breathing. And later in the episode, Dr. Brian will talk more about the 6 ways that you can naturally increase your nitric oxide. But I do want to share one with you now, which is a key strategy of red light therapy. Now, what red light therapy does is that it penetrates several millimeters into the tissue of your skin, and it actually releases nitric oxide bound to heavy metals. But there's also a lot of other benefits of red light therapies pertaining to improved sleep, recovery, and also skin health, because red light therapy improves your cells' mitochondria. Now, you can do this through natural sunlight exposure, especially in the morning, but some people don't have access to natural sunlight for a few hours, maybe due to work schedules or maybe because of where you live. And that's why investing in a red light therapy device might be beneficial. And that's why I have Bond Charge as a
So Bond Charge is somebody that Dr. Jack Kruse has mentioned, and she's plugging it there, and she's actually she helps them sell stuff. So I did want to hear that. I thought that was a good clip just to hear the effect of red light, and it's more and more people are saying it. So
it's not just, so we talk about blue light blocking and red light therapy, but it's not just red light; it's infrared, right?
Well, sunlight.
It's both.
Well, sunlight has all the spectrums.
Well, right. No. But when you're just specifically talking about going to do red light therapy, is all I'm saying. I'm not talking about the sun.
That's infrared.
Okay. Yeah.
So I'll probably cut back on the infrared stuff during the warmer months when I'm outside in the sun naturally, and do it more seasonal. I'll do cold plunge probably all throughout the year.
Sure.
Did you sound like you had something you wanted to say there?
No.
Okay, so let me get to the next clip here that I think is relevant.
No one.
Well, it's like statins.
Yeah, and statins too. Number one, cholesterol doesn't cause heart disease, so why would you target lowering cholesterol to mitigate heart disease? Heart disease is still on the rise. These statin drugs have been on the market now for 30 years. And if cholesterol caused heart disease, as the American Heart Association predicted in the late 80s, when you lower cholesterol, it would completely eradicate heart disease and cardiovascular disease. And in fact, by the turn of the century, heart disease has gone up and continues to go up despite getting cholesterol levels below 200. So again, those clinical observations tell us that cholesterol doesn't cause heart disease. Statins have not affected the rate of cardiovascular disease whatsoever. In fact, we see it going up. And so what are the consequences of lowering cholesterol? Well, you develop type 2 diabetes,
Yep.
You develop all this myalgia. They're mitochondrial toxicants causing cancers. But in terms of nitric oxide production, we need cholesterol in the cell membrane because it's this intracellular signaling. We have to maintain some fluidity in the cell membrane. Without cholesterol, we lose that fluidity. These protein complexes fall apart, and nitric oxide is part of that intracellular signaling. And if you get cholesterol below 200, you disrupt that lipid raft, and it leads to complete inhibition of nitric oxide production. So then leading to increased risk of heart attack and stroke and cardiovascular disease, which is what we see in the general population.
Many doctors talk about.
All right.
Yep,
all right.
let's hear it.
Here we go. The cardiologists are lining up to fire, bullets at that guy because all the cardiologists believe that high cholesterol does cause heart disease. And, if you confront them with why is there more cardiovascular disease despite the high cholesterol, and they always go to this. There are more people today. So,
well, if you're a hammer, everything looks like a nail. Right?
That's right. That's right. The specialization of medicine has pushed people, namely physicians, for doing that. If you're a cardiologist, putting wires in somebody's heart is all you do, and that's why I am thankful that I took 3 years of broad internal medicine before I ever specialized. And the one specialty that I took, which is pulmonary disease, you have to know a whole bunch about everything because it's not just the lungs that you're dealing with. It's the kidneys, it's the heart, it's the GI tract, it's the brain, all of those things. So I felt like instead of having 3 years of general internal medicine, I had 5.5.
Well, I think that's why, to me, it's so fantastic putting information like this in front of you. First of all, because I get to see you see it for the first time. I get to see alignment of things that you've always thought, but it hasn't. You have to have the right people studying the right things, talking to other people that are talking to other people that are studying the right things, and then you merge that information. I mean, what artificial intelligence is to me, with taking technology out of it, is taking the best out of all the arguments and making something smarter in the end.
Sure.
And I feel that's what we're doing, because you can look at historical things, you can all the things that you said, and we shouldn't do that because it caused these problems. I mean, we don't have that. Yeah. We don't have people that are willing to talk about it. So
no, and a lot of people don't. They weren't around in the 70s and 80s, and so all they know is the 21st century stuff.
And especially medical doctors who've been trained in medical schools that are funded by pharma.
Oh, sure.
I mean, talk about hammer and nail.
You mean that they're of course. Our first year in medical school, we got a free doctor's bag and free stethoscope.
How many nutritional courses did you have?
Now, I can tell you about the nutritional courses, so let me finish what I'm talking here. They gave us, the first year, they gave us a doctor's bag with our name on it, and they gave us a stethoscope and all the other tools we needed for diagnostic work, and that was provided to us by Eli Lilly, who is a very big pharma group. Now, as far as how many hours of nutrition did we have, we actually had a month, and that was included in our gastroenterology and endocrinology.
But even at that, a month back in the 70s, right?
Yeah.
It's changed. I mean, how many times has the food model and what they say is good, bad, or indifferent changed in that amount of time, and how often has that been right? Dear God.
So many. I remember when
the
broccoli
food
was bad
pyramids,
for you. Eggs were bad for you.
Meat's bad for you.
Yeah. Well, that was the whole cholesterol thing. Eggs and butter were bad for you because they had fat in them.
And it's like the exact opposite of that.
Well, and what they didn't take into account is that 85% of the cholesterol in your bloodstream is manufactured by your own liver. It's not absorbed through the food that you eat. And, I figured this out the night before we were going to be tested for our cholesterol in the first year of medical school. I ate 3 egg salad sandwiches the night before. And then they went and drew my cholesterol, and it was low. It was like 145. And so I said, interesting. It doesn't mean that, if you eat cholesterol, then that doesn't necessarily mean that you have high cholesterol.
It's about how your body is, what it's doing with it once it comes in.
So if it's produced by your liver, does alcohol consumption change that?
No, not really.
Oh, okay. I was curious.
Yeah, but alcohol consumption does change the function of the liver.
Yeah, we're gonna talk about that. That's definitely something we're delving into. All the things that we got to get rid of at some level. Let's keep clipping because we got a hard out, and I want to make sure I get through this as much as we can.
We still got like 45 minutes, man.
Better hard out than hard on.
That all these medications, especially statins, actually increase the likes of dementia. There's actually more risk versus the benefit. But I think it's to do with the industry marketing. So if you have industry and companies marketing this, obviously people are going to be thinking about that. I want to circle back to nitric oxide. And I guess I have a bit of a bold question for you. Do you think that if we can boost our nitric oxide in the body, that is a way to fix all brain disease?
I not only believe that, I think I know it from the scientific literature. Because if you look at neurological disease, and if you look at the work of Daniel Lehman, who has the largest database of SPECT scans in the world probably, no matter what neurological disease he looks at and maps through SPECT scans, which really give us a view of how well perfused or what part of the brain has adequate blood supply, or more importantly, what regions of the brain have complete focal ischemia or lack of blood flow. And so it doesn't matter if it's Parkinson's disease, dementia, Alzheimer's, bipolar disease, ADHD, post-concussion syndrome, chronic traumatic encephalopathy. All of that is characterized and shown in SPECT scans that there's a disruption in the regulation of blood flow to certain regions of the brain. And you cannot correct that until you restore blood flow to that part of the brain. Now, I think it's part of the picture. There are other things that contribute to neurological disease. There's heavy metal toxicity, which leads to Parkinsonian type syndrome. There's other toxins that may be present. But if you can restore blood flow to the brain and start to deliver oxygen and nutrients and restore mitochondrial function and potentiate insulin signaling and glucose uptake, the primary energy substrate of the brain, then you can start to restore normal neurological function. But I think it's twofold. We got to restore blood flow to the brain, and we've got to remove the toxins that may be contributing to the neurotoxicity.
Well, I wanted to say this first. There are 2 words that should never be used in medicine. They're always and never. Yeah. Because there's never always the same thing and never on the other end. So you've got some gray area there, and medicine is a huge gray area. So I don't like the use of always or never, because I had a professor that said, you always do this, and then I showed him an article that showed that they don't do that, and it worked just as well. And he said, well,
he changed his mind.
Yeah, he
pivoted. So.
He pivoted a little bit, but he also downgraded me for that.
See, I think a third word that you shouldn't use would be oops.
Oops.
If you're starting, if you're doing brain surgery and you go, oops.
Yeah, that's for surgeons.
Okay.
Yeah. Although I've seen that used for non-surgeons as well, like obstetricians. Well, they are sort of surgeons. They only know how to do five operations.
Episiotomy and
Yeah.
You guys
Oops.
killing me.
Yeah. All right.
Are we ready for the next one?
Sure.
I lost the
Go
money.
right ahead.
Because I have it down.
What do you think is the number one thing that we can do?
Well, I tell people, the human body is extremely resilient. We just got to get out of the way. So I tell people the first thing you do to restore your nitric oxide production is to eliminate the things that are causing a disruption.
Right.
And we've discussed those. So if you're using mouthwash, you have to stop. The data are very clear that we have to support the microbiome. We cannot destroy it. Number two, you have to get rid of fluoride. Fluoride is a neurotoxin. It completely destroys your thyroid function. It competes with iodine binding to the thyroid hormone. It's a halogen on the periodic table. We can't forget the basic chemistry of that. And then, as I mentioned, it's a neurotoxin. In fact, it's the active ingredient in rat poison. I mean, the fact that we're giving fluoride in the municipal water supply and in the toothpaste, and all you have to do is if you go look at your toothpaste now, and if it has fluoride in it, read the back label, and it says if you swallow
poison,
this,
yeah.
contact poison control.
Yeah, see, we've already listened to some of that.
Because
Yeah.
fluoride is a poison. So you have to get rid of fluoride. And if you live in a city where there's fluoride in the middle,
Yeah, he kind of hit on it.
I think I've explained in the past the reason that there's fluoride in the water supply.
Yeah, you have.
And
I just don't agree with it.
You don't agree with it?
Not in any way, shape, or
Well,
form.
that's the dentists that ran all that. They said, that they found people who had high rates of fluoride in the water naturally.
Well, this guy,
fewer.
this guy, and another guy that I'm going to probably won't get time to
Is
share.
this guy a dentist?
Yes,
He is?
I believe he is. But this guy has, similar to what you did with AMA, has said ADA is the same.
Oh, yeah.
the same deal.
Well, so
Yeah, I've been like that.
Go ahead.
No, I have a question. Of course, I'm not a doctor either, but when he said that about fluoride, about mouthwash, and all that stuff, ultimately, that's only a problem if you ingest it, correct?
What's that?
If you
Ingest
swallow
it, if you swallow it.
Well, it's a problem because some of it is going to be absorbed
It will be.
through the
but-
mucosa.
So
It will be.
the answer is no. It's not just that. And I strongly recommend you listen to this whole thing because I can't get all the clips.
No, I know.
He talks about how fluoride basically will break down the microbiome of the tongue.
Yeah.
And it doesn't allow the nitric oxide to naturally occur in your mouth. And so basically it reduces it to the point where it's not working. So it's a toxic chemical that doesn't allow nitric oxide to work properly, to come to fruition properly in your body.
Man, that's tough whenever it's been just
Dude,
bashed over
everything's
your
tough.
head.
Everything's tough.
No, what I'm saying is when it's been bashed over your head that fluoride is like you need to brush your teeth, you should use
they've
mouthwash,
been doing that for 70 years.
Dude, we've been lied to so much. It is
But
crazy.
I mean, if somebody who doesn't brush their teeth, they usually get jacked up teeth, like cavities, and need dental work and like all that kind of stuff. Like, I mean,
oh, that's very anecdotal. Yes.
No, I live with one.
I know, but
Yeah.
my wife, half her teeth are not real teeth.
I get
like,
it.
and it's not
Well,
because it's just, well, she kind of, it's sort of a genetic for her.
you
but
can brush your teeth and not use something with fluoride in. For example, sodium bicarbonate. You can brush your teeth with that, and that does just as much good as brushing your teeth with, Colgate that is blue from the.
We're really going to dig into this deeply, not as much today, because I'll tell you, I've got this other video podcast that I listened to from this other gentleman is talking about some of the same things. I've got one clip that is, I think, might be dialed in right for this insight.
It's not perfect, but seek out someone that speaks to you about the oral microbiome, that is aware of everything that we talked about today, that does kind of talk about all the nuances, that starts off upstream, root cause, why are you here? Why are you here with that big hole in your tooth? I can fix it, and you always need a good clinician, but let's prevent it from occurring again. I think that's where a lot of frustration with our patient comes from. They keep going back to the dentist for the same thing over and over, and the money just piles up, and then the time in the chair and the pain that goes along with it and the discomfort. It's really unnecessary if you think about it. And the profession needs to do a better job. We need to stop relying on things like fluoride. The Cochrane group, they're known for big systemic reviews and overviews of all the studies. They just updated their review on fluoride, and they just said basically there's no benefit to fluoride in the water. And why are we even bothering? And now, if there's a threat to the brain of children, the developing brain, why are we even including this? So, despite that, the ADA, the American Dental Association, the Dental Pediatric Association, they're all digging their heels in. They say fluoride is good. It's not. All the study is against them. All the studies and the research supports that there's no benefit to ingesting fluoride, and there's certainly a lot of harm.
Yes, and it's so interesting. There's conflicting arguments around fluoride still. It's harmful, but some people are saying maybe it's beneficial. But I think that if people follow your advice outlining this, did you want to say something about that?
No, I agree with you. It's so hard to undo 75 years of dogma. I mean, it's the same thing with the demonization of fat and meat, right? It's the same thing. And that now we know that was a big mistake. And it was based on that one study. And that one doctor, that MD from Harvard that was going around saying, oh, no, and of course he was on the payroll of Big Food. He was saying, oh, no, cholesterol's bad. It's bad for heart disease. Eat these carbs. It's the same thing. It happens in so many different areas of healthcare, but certainly in the food chain and in the water that we drink.
Absolutely. Well, Dr. B, thank you so much.
So I remember that clip. That was the only one I took from that particular podcast because I'd listened to it once. Typically what happens is I listen to something once and I don't clip it, and I go back and listen to it, and then I'll take pieces out of it. And you said what you said. I'm like, there it is. I mean, it's dogma. It's something that the thing about the AMA, the thing about old doctors that aren't willing or open to change, they will put their heels in because they don't want to be proven wrong, because they don't want, there's a movie and they talk about, it's the Judge. If you've ever seen the movie The Judge with Robert Downey Jr. So at some point he became mentally compromised. He got the judge got dementia, and he basically killed someone by accident or on purpose because he had an episode and he ran over this guy, and his son, who was Robert Downey Jr., basically came in and said he doesn't want to admit that he's sick with cancer because all the times he spent in the chair whenever he was potentially compromised, those cases could then be fall apart. So, but it's different with doctors because it's reputation and it's pride.
Sure.
And it's, what can we do? We can't change the system. The system it's what keeps us going. I mean, it just doesn't. You can't build truth on a lie.
Well, hopefully
you have to rip the Band-Aid off.
RFK will come in and get rid of the fluoride, hopefully.
Dr. Jack is in RFK's ear very heavily. Sure. He's in Nicole Shanahan's ear. I mean, Dr. Jack is treating Nicole Shanahan's autistic kid.
Is he going to get to come back home?
Anyway.
I seriously doubt that. He doesn't want to come back home. Wow. He's perfectly happy in El Salvador.
Oh, you're talking about Jack?
Jack.
Okay.
Yeah, sorry, Jack.
Yeah, I don't think he'll come back home. I mean, he's in the sun zone. He thinks it's safer there now.
He's wallowing in Bitcoin.
He's definitely wallowing in Bitcoin. That's good. Okay, so let me go ahead. You got something to say?
Do more.
More what?
Show me more, Daddy.
Well, so I my only pushback, like you like to just push back sometimes, even if it's not your feeling on things. But so like this one guy is saying that fluoride's bad. Like, how many people does it take to actually back the fluoride's bad versus the fluoride's good, folks? Like, how can we really get to that?
How does it? Well, you've got an entire industry, an entire platform of the ADA, and everyone that is in a part of that establishment. That if they say they were wrong all this time, it's going to throw everything else into question. So I don't know how you do that from the inside out. You have to do it from the outside in. It has to be grassroots. It has to be you telling your wife, look at these clips, look at all this data. That's what I'm trying to do. I'm trying to put enough information together and stack so many people that are saying, if this isn't true, prove it. Prove to me that fluoride, like let's do a case study, like we're going to take away fluoride for a year. And we're only going to do the things that these teams of doctors do, and let's compare. A
year's not enough.
I think you can. Well, I mean, I think anecdotally it can change actually, because what this guy's. Let me just finish this point, because he's talking about. You mentioned something that you could put in toothpaste.
Yeah.
There's a whole thing that they're recommending here that actually could change things very rapidly. In my opinion, you couldn't prove it long term.
They've already talked about the children that were given xylitol gum.
Yeah, that one. And where was that? That was
in
some foreign country.
Yeah, it was in
Africa or something.
It was in Africa.
Yeah.
And they were given xylitol gum to chew 3 times a day for a year. And then they came back 10 years later and they had fewer cavities than the kids.
Even though they weren't using xylitol anymore.
When they're not using xylitol, they had fewer cavities than the kids that weren't using anything.
So there's 2 things. I'm going to share this clip, not this clip with you, but there's definitely some things here I feel like you'd find interesting, especially since your wife is, my elderly dad just had teeth removed. Dr. Roy's had to deal with some of that. And it's all about, we haven't been taught to properly take care of our mouth. Our oral hygiene formula is not working. There's no way that our teeth should be falling out. There's just not. You look at prehistoric peoples and jaws and skeletons and Indians. Mm-hmm. They'd never had that breakdown until all these changes were made to our diet and to whatever they say.
Yeah, it's probably mostly diet, I would think. Probably sugars and I don't know. There's probably a lot to our diet.
Well,
but there's other parts
sodas
too.
And all that kind of stuff.
But my pushback a little bit on you saying, you put enough people together that tell you this, that, and the other. I could put enough people together to tell you that Sasquatch is living in your backyard. No,
you've got every dentist on the planet.
But every dentist on the planet doesn't necessarily say that fluoride's bad.
Every dentist on the planet that wants to stay licensed,
at least in the United States,
will not buck the trend.
Yeah.
I assure you that. Same thing with him.
Well, exactly. Will not buck the trend. So they will not say that fluoride is bad.
Fluoride.
Yeah, exactly. That's what I just said. So if they don't speak out against it, you've got other people who you're talking about piling up enough people that says fluoride bad.
So people,
and I'm saying I could find somebody who said Sasquatch alive.
Oh yeah.
I'm not saying that I don't believe this. I'm saying if you look at it from the outside, you're talking about piling up enough people. How can we actually prove it?
Well, I think it's teams of people,
and you kind of talked about
working together,
or not tests, but
we could compile. I'd be in a study tomorrow.
There you go.
I'd be in a study tomorrow, one of 10,000 that if the government or some apparatus puts together, we're gonna buy you blue light blockers. We're gonna do these things in your house that help reduce whatever. I'd do that for 3 years for free. Just give me the product. Let me put the right lights in the thing. Mm-hmm. Let me put the screen blocker on, and compare me to somebody that won't do it. Mm-hmm. And so it's going to take time, but so does a study that goes through pharmaceutical. A vaccine's supposed to take 10 years or 20 years to actually be legitimate. Yeah. So it does take time. Mm-hmm. But anecdotally, you can say, okay, show me people that are doing this therapy they're not responding well to it. If they change their microbiome, oral hygiene strategy, and they're not getting cavities anymore, or if their teeth are healing themselves, or their gums are better, they're not bleeding because they're doing these things. Does it prove anything? No, because you got to wait 5 years or 10 years.
So are you going to change one variable or all the variables?
I would do the things that these people are saying, unless there's a huge risk that I see. Like if they say take this supplement, I'm going to be like, whoa.
Well, no, but I'm saying so you're talking about doing 7 different things in a single study, and don't you want to kind of pinpoint?
No, you can do a few of them.
Increasing nitric oxide is kind of a pivotal thing.
Right.
So what you need to do that.
Okay. Yeah, never mind. Yeah.
So we're talking about 2 different things, kind of, but because we're basically talking about why our mitochondria gets broken down and why our body starts to fail. Mm-hmm. Right. And there's multiple factors. We got exterior toxins that are coming in, light, electromagnetic, and we have stuff that we put in our body internally and that are coming in through food and water and all these other things. So it's not a this or that. It's whatever has fluoride in it. You need to remove those things if you want to be in the test group, So anyway.
Well, it's toothpaste, mouthwash, and drinking water.
Yeah, and he mentions antacids too. So I'm going to put all of these clips, as I always do. I'll put the clips in, but I'll put the full video link in. I'm not going to hit on the antacid thing, but apparently there is a correlation of taking antacids and it not allowing proper nitric oxide creation. So,
man, sometimes the heartburn's unbearable.
Well, there's ways to fix that. Naturally.
No Taco Bell. I'm not getting rid of my Taco Bell.
There we go. Okay, so
Go for
I
it.
think we've hit. Well, I mean, I could share a few more of those clips, but I want to not spend the whole time on that one video.
Sure.
But I will share that. Actually,
Do we? So one thing I want to talk.
I'll end with one, but go
Okay,
ahead. You,
but no,
you go ahead. I'll
do your clip here.
No, just go ahead.
I was going to change. I'm going to jump ship. So did you do this, and then we'll talk.
Okay,
after.
just don't forget where you were going there.
I won't.
Okay. This is just a funny. We kind of started the program with something funny. I thought
a lifestyle disorder. It's really the canary in the coal mine, because if you can't regulate blood flow to the sex organs when you want to have sex, then you can't regulate blood flow to the heart when you want to exercise. You can't regulate blood flow to the brain when you want to think or deliver a speech. We see that in the public American politics today, all day, every day.
Are you talking about Joe Biden?
It's dysregulation of blood flow. Yeah, Joe Biden is the poster child for nitric oxide deficiency.
Sorry, I had to throw that one in there.
And Mitch McConnell.
Yeah. Anyway, go ahead, Travis.
I mean, I can't really control my. Anyway.
Never mind.
No, I was talking about like blood flow in my brain. Like if I'm thinking, like I don't like cognitively control my blood flow to my brain when I'm thinking. But he's talking about nitric oxide.
It does it naturally without you knowing it.
Well, yeah.
If you're asleep, it shuts off and you don't think at all.
Yeah.
If you're meditating,
some people in their awake they don't think at all.
You have dreams.
Yeah. If you're meditating, your brain shuts off, so you're not sending blood to work anything because it's not working. So blood can go elsewhere.
Okay, so switching. I was going to switch the subject since we were kind of going to get done with that.
Yep.
So we talk about a lot of different things, and we've talked about healthcare, and then insurance hasn't ever really come up. But recently, the CEO of United Healthcare was murdered, and they think they found the guy. Although there's some conspiracies about it, because the dude on the video didn't have the unibrow, and the dude they arrested has a unibrow, and like there's or a big eyebrow. But anyway, there's a lot of people.
He also has a social media presence, and none of the Trump shooters had any of that. They all had that scrubbed.
Yeah. And there are so many people that just think he's a savior. Just think it's the greatest thing to kill this one guy. No, there's a lot. I mean, I bet the's it's maybe not 50-50. I bet it's like 60-40. There's a lot of trolls out there, but there's so many people on Reddit, so many people on Facebook, even everywhere, that are talking about this guy, it's what was it? I didn't see him do anything because he wasn't in my network or whatever, some, just stupid crap. But they're all talking about how it's great that they pretty much put a noose around this guy's head, and they're wanting to, other people are, I've seen people out there saying, locally, I saw somebody, because he's kind of a douche, say something about the CEO of Centerpoint. It's like, I'm just starting a conversation here, but the CEO of Centerpoint. And I'm like, why? Anyway, I just thought, I don't know if you'd seen any of that, or if you had any thought about that.
Those people are just puppets, first and foremost.
All right, Doc's waving his hand.
I'll let you go.
Yeah, go.
Those people are just puppets, and if you take one out, there's going to be another one to fill the void.
Well, they're not even controlling they're not the direct control of procedures.
Yeah.
But I mean, maybe they're the one person you can try to say, if I want to put one person to the head of the snake or whatever, I'm going to use the CEO.
Guess what? The head of the snake's going to go right back.
And he didn't.
It'll grow right. It's like the
reptiles that can regrow.
The reptiles that can regrow. Listen, I spent roughly 10 years in the insurance industry. I worked for United Healthcare. I worked for Aetna. I worked for Cigna. I worked for the Blues, Blue
Cross, Blue Shield.
Yeah, Blue Cross, Blue Shield, those sorts of things. And they all of them had multiple layers. If you killed the top 10 people in each one of those, there would be people waiting to fill those holes and continue. I always had somebody right behind me who was able to jump into my what I was doing. I was the chief medical officer for several of those. I was chief medical officer here for Aetna. I was the chief medical officer for Blue Cross Blue Shield of Montana. I was the chief medical officer for United Healthcare in Louisiana. So a lot of different places. But there were people who would or could jump into those things if you killed off the top. And in Blue Cross Blue Shield, the board of directors in Montana, they decapitated the leadership. And that's how I ended up leaving, because they got
Not literally, but figuratively.
figuratively.
You started the decapitation. I was like, wow.
Yeah,
They're not lizards, and they did not die,
Yeah,
but they weren't on the board anymore.
Right.
So they just got rid of the leadership because they didn't like the way things were going. And it wasn't a matter of making money. It was a matter of the direction that was being taken. So
the answer to part of this,
I just wondered what your guys' thought was on all that.
Yeah.
So now we're talking about two different things, kind of a little bit.
Like the
So I feel like the CEO head getting cut off is like he's. I don't want to minimize what happened. It's horrible.
Yeah.
Anyone that would do that is freaking crazy, and it solves nothing. And the dude had a wife and 2 kids, I think. You've harmed them forever. And was it their fault that their dad was in a business that's shady, that we could all say that definitely is shady? Is it his fault that he's in a business that's shady? I would say no. But at some point, we do need to come to reckon that, just like we heard how do you believe the dogma of the last 75 years? And then once it's, you get to the heart of the truth on why they make the decisions that they make. They don't make them for health reasons. They're making them for financial reasons.
Yes.
There's perverse incentives throughout the American Dental Association, through American Medical Association, through pharma, through insurance. It's all perverse incentives. Has nothing to do with being better for Dr. Roy or being better for you and your wife or your daughter. All right, I got another clip. Am I muted up here?
You are.
Okay.
Now you're not.
Okay. The doc, this is, I don't think we're quite done yet, but this is something I heard this and it resonated with me to the point, because you and I are trying to get to something with making medicine great again, or making doctors trustable again. And I think this is actually a pretty good clip, and we could riff on it.
Kidney failure and metabolic disease and diabetes. And sunlight seems to help. They're telling us to stay locked in our homes and bribing us with pizza and cookies later on if we get the shot. All of their recommendations seem to run counter to what a normal human being should be doing in response to this pathogen.
Actually, I think there's a very good example of why the look it up because you can't stand not knowing mentality is dangerous. There's something about the way COVID unfolded chronologically, where we now know that doctors using ventilators killed a lot of people.
Right.
Why? These were doctors faced with sick patients. Why did they put them on ventilators if they shouldn't have been put on ventilators? The answer is these doctors did not know that they were downstream of what we now understand to be false information coming out of China about how severe the disease was.
Right.
So doctors had been primed for a much deadlier disease than actually arrived. They had watched people collapsing on the sidewalk in Wuhan, right? And what they needed was a tool that would have allowed them to evaluate what they were seeing, so that when the patients walked through their office door, they would realize, you know what? That's not a match for what I saw on my computer screen. Therefore, maybe I need to rethink what the right approach to this patient is, rather than assume they're, about to die and I'm in hero mode and I'm going to stick them on the ventilator as a last-ditch effort to rescue them. So, our doctors failed to have the tool. What they had was what masqueraded as knowledge and wasn't, because those videos were in large measure fake.
Yes.
That's it.
Yeah, I'm totally in agreement with that, because I was there. I could evaluate people. I only sent 2 people to the hospital in this during COVID. The rest of them I managed to treat outpatient. The majority of them took ivermectin at my suggestion. A few of them had heard the whole thing about horse paste and
fish tablets or whatever.
yeah,
Right.
and declined to take ivermectin. And so they got whatever we had there, Pavlovid or whatever was there. But it's a very, it was a very trying time.
Yeah, and so before you do an ivermectin plug, which you came prepared for a little bit of something there,
Yeah.
Travis, I think this revolves right back around to how can we dismiss or get around 75 years of, you didn't call it dogma, but 75 years, our whole lives we've been told, this is what you do, this is how you do it, this is why you do it, and this is going to give you good teeth.
Mm-hmm.
COVID took something that usually takes us 75 years and put it in a very small microcosm where you could see it really fast.
Yeah.
So you saw bad decisions based on dogma or based on something that wasn't real. It was propaganda or something that they saw, or they assumed that it was the same variant of the same exact thing that was going on in the streets of Wuhan, whether that video was right or not, whether it was even legitimate.
Mm-hmm.
When it got here, who knows how much longer or how different the variant was. And the doctors were, I don't even want to say dissuaded. It seemed like they were forced to all respond the same way. They couldn't use their own eyes, and they're listening to their patients, looking at them, poking their skin. Dr. Roy knows if someone's near death. He can take a look at, I guarantee if he walked in and there was 10 people and we knew 5 of them were dying, he could probably walk in and say, this person's not doing very good. This person's, right? Am I right? So
this one's going to die.
So just because they got COVID, they were in the hospital and they jam a ventilator in their thing, which was the exact opposite of what they should have done. Exact opposite. It caused more damage than it ever did good. It probably killed more people than it saved.
And the way it caused the damage was because they put them on a ventilator for a period of time and left them on a ventilator for a longer period of time, and they got a bacterial infection that overran the infection from the COVID, and they ended up getting Pseudomonas pneumonia, and that's almost impossible to get rid of. So
most of them didn't die from COVID; they died from pneumonia.
They died from pneumonia, or they died from
COVID complications.
Right?
Yeah, COVID complications. But let me tell you, they all had a COVID stamp on them when they died.
Did you have something else?
Sure.
I was going to ask the doc. So, I mean, what were the whole reason for that was due to oxygenation, right?
Yes.
The whole reason why that. So, could you not have put somebody on just like an O2 line, or I guthey would have tried that already?
We did that, and sometimes that helped. But a lot of times, they
or what should have they done? I guess instead of the ventilator.
Well, they should have made. You can put them on a ventilator, but you need to get them off the ventilator as soon as possible. Mm-hmm. And they didn't do this because, and the ventilators were germ magnets, and they all got Pseudomonas pneumonia or some other sort of gram-negative pneumonia, and that's why so many people died. The other thing is they took people who were recovering from COVID but were still infectious and put them in nursing homes where there were healthy people, and the healthy people got sick, and the healthy people died.
I had the exact opposite of that, though. They wouldn't let anybody in my grandmother's nursing home. That's why she died. She died of
loneliness.
But
loneliness.
It wasn't the visitors we're talking about. They took people out of the hospital who were recovering from COVID, but still contagious, and put them in the nursing
back
homes,
home, quote unquote,
instead of letting them go home. Or instead of using, this is New York City I'm talking about.
Oh, you meant used it as a middle ground to recover.
Yes.
I thought you meant actual, they lived in a nursing home, then they got COVID, so they went to the hospital, and then they came back like home. But that's not what you mean. They
were sent to a nursing home as a middle place before they went home.
Gotcha.
But in the meantime, they infected 14 other people who got COVID, and many of them died. Anyway, like I said, I had COVID very early in the pandemic, And I sucked it up and stayed at home and did okay. Now, I was sick for about 10 days, and I was weak for about 6 weeks afterwards, but I still went back to work and wasn't, pushing germs out at people. So it was there, but I treated roughly 120, 150 people with ivermectin, and of that group, none of them had to be hospitalized, and none of them died.
Speaking of ivermectin, do you want to talk about that at all, Doc?
Do a quick plug. Then I got one more clip after the plug, and then we got to do a hard break.
We are blessed to have a supply of ivermectin that you can purchase from us. Now, Dan Bongino's podcast is selling 3 milligram tablets of ivermectin for $3 each. What we're selling is 12 milligrams, so that's what it really takes to get rid of the COVID. It's 12 milligrams a day for 5 days. So we're selling it.
And that pack there is 10, so that's enough for 2 people, or two different cases of COVID if you're
that's enough for 2 people, and it costs $30. And it works really well, and it still works, because not a month ago, I had a patient call me and said, my husband and I both have COVID. Can you give us any help? And I said, I'll be right over. And I went to her house with some ivermectin, and she gave it to her, and she said, oh my God, thank you very much. And how much is that going to be? And I said, $30. And she handed me $30. And she said, I texted her about 4 days later, and she said, oh, we're doing great. We're over most of it.
So that's great. And not today, because we're cut for time. Dr. Roy is looking into some other information that's coming out about ivermectin, different usages for it.
Yeah.
You had said that one of is treatment for scabies, which I've not really heard a lot about that, but you said there was just an outbreak here locally not too long ago, and it is something that can actually fix that issue.
Yes.
And there's a lot of other information. You talked about some lab animal studies that says ivermectin may be good for cancer and some other things.
True.
But there's no real studies showing that yet. So we're going to stay on the front edge of that, folks. And and we promise to do that.
So if you would like to purchase some ivermectin tablets, you can contact me on X at Air Rescue Doc, or you can contact me through the podcast or
Facebook. Facebook, you're Dr. Roy Arnold.
Yep, Dr. Roy Arnold.
And if you're watching me, I'm at Chad Schmidt on Twitter, and same at Facebook. You can find me, and I'll get you in touch with.
I've sold 3 groups of people some ivermectin in the last week or 2.
Mm-hmm. Good.
So,
all right. So I got one more clip. This last clip basically is a shared Twitter. Dr. Jack Kruse is very active on Twitter, and he's just igniting people. One of the people he doesn't like very much and says he needs to have a space in Guantanamo Bay is Bill Gates. And the only reason I want to throw this out there is, first of all, it's a vaccine issue, and it's something that me and Dr. Roy are talking about, vaccines going back and forth, good, bad, or indifferent. And this gentleman basically shows that what Bill Gates did in Vietnam. And here you go.
Vietnam doesn't have anything. There's no such thing as autism in 1975, in year 2000, year 2001. There's no such thing. When Vietnam signed the WHO, and when Vietnam signed into the International Monetary Fund, the banking system, Bill Gates and the Gates Foundation introduced the vaccination program into Vietnam. Now Vietnam has over a 300% rise in autism.
Okay, so that in and of itself seems a little anecdotal because we're not talking about all the other stuff.
Yeah.
But whenever you hear enough of these things that are shared with us over time, it's again one of those things. It's like, are you going to wait for the vaccine industry to tell you that yes, these things cause autism?
They never will.
They never will.
It cost them way too much money.
They never will. Or do you make different decisions? Do informed consent? Sorry. Do your own research. Talk to doctors who are open to taking old dogma and breaking it down, listening to new information, and changing your mind.
Sure.
We can't go through what we've gone through since COVID in any short-term burst again, because that was very tyrannical. We gave up way too many freedoms, and a lot of people died for no reason. And we also can no longer put up with the long-term stuff that we've heard from the bad actors in pharma and AMA.
You know, one thing we don't talk about, and this just comes from me being a small town boy with family who owns a lot of small businesses, but not only did a lot of people die, but a lot of small businesses died.
Oh,
my.
yeah.
Yeah. 100%.
And at the time, I don't know if you remember, but like some of the big businesses were still allowed to function in ways that smaller businesses were not allowed to function.
Oh, yeah.
Like Walmart stayed open when your local grocery store was not allowed to be open. Like it was, anyway, sorry, I digress.
Well, and in medicine, a lot of the dentists couldn't work because that was considered non-urgent.
Right there.
Yeah. Oh. And the optometrists, I had a friend who is an optometrist here in town, and she said, we're taking emergencies only. So she wasn't fitting people for glasses or doing evaluations or anything. It's just if somebody had a splinter in their eye, then she would take care of them.
Yeah.
And other things that my friends at the OSPA, they were out of work for about 2 or 3 months, because they were considered non-essential. And yeah, it's not really essential to go and get your hair done or get your back massaged, but
it's essential to keeping your power on and your mortgage paid for.
Yeah, that's right. And
and what Travis is alluding to, I think the businesses that were like, they did give some money. The federal government gave some money, which we're going to pay for
back
forever.
Yeah.
But at the end of the day, a lot of those businesses never recovered because you lost momentum, you lost some clients. Yeah. A lot of people didn't come back into circulation for a lot longer, so numbers were down. How many restaurants went away? Oh my gosh, unbelievable!
A lot of them, yeah,
unbelievable.
And so anyhow, we were considered essential, so we stayed open 5 days a week the whole time, and actually didn't see that much of a drop off in the numbers of people we saw, because people came in because they were sick, or people came in because it was time for them to have a checkup, and we took care of it.
Or just scared by
scared
the media.
I mean, I had one lady that was just having panic attacks 24/7. And the first thing I told her to do was quit watching television.
Yeah, right. Back then, definitely.
Don't listen to the radio. Don't go on the internet. Just forget about that. Get a nice book from the 19th century.
Sit in the sunshine.
Yeah. Yeah, right. Go outside.
Are you kidding?
Or you're allowed to anyway.
You couldn't go outside. It was scary out there.
Your backyard, though, man.
I went outside all the time.
Yeah. When the government was telling me I was out on a beach in Florida illegally.
Yeah.
And they said, "Oh no, you can't. You got to shut down the beaches because we're going to spread the virus on the beaches." I thought we have reached the epitome of stupidity on the planet.
Well, and they closed all the churches. They closed all the churches and synagogues, but they didn't close the mosques.
Interesting.
Oh, how about that?
So I got one more clip. This is an older one. I actually had seen this one a couple years ago, but just to kind of piggyback off of what Dr. Jack shared about Bill Gates. Also, knowing that Nicole Shanahan's kid has autism and she's working hand in hand, I just think the more people see these individual stories, like stories sell.
Yeah.
Like we could share data, we can whatever. When you see two people that you're going to see in this clip who you'll know both of them. Well, most people definitely know Jim Carrey, but Jenny McCarthy is his wife and they're married. Yeah, obviously they're married, but she was an actress and I think she was a swimsuit.
So she did that game show. She was
before that. She was on Baywatch, I think.
Oh yeah,
she was on Baywatch, and she was in Playboy, and all the others.
Anyway, the story is worth hearing.
That was killing children. That we had to triple the amount of vaccines.
What happened after 1989?
The why did they
that warranted 26 more vaccines?
Greed.
Are all of them absolutely necessary?
They want to make money.
Of course.
It's twice as many as anywhere else in 30 countries in the Western world. But we give twice as many shots as any of those countries. Why is that? I don't think we can afford to assume that the people who are charged with our public health any longer have our best interest at heart all the time. Parents have to make their own decisions, educated decisions. They have to look at the information.
Space out the vaccines, delay them till after 1, clean out the toxins that are in them. We don't need that many.
Why would a doctor not want to know more about something that could save a life or prevent a disease? I don't
they're too busy.
The AAP is financed by the drug companies. Medical schools are financed by the drug companies. This is a huge business. Vaccines are the largest growing division of the pharmaceutical industry. $13 billion.
This was before COVID.
What we're asking is for them to take a loss for the good of our children.
$13 billion. Vaccines are probably one of the biggest industries in the world. Just make sure you're taking your health into consideration, into your own hands, knowing what you're eating, knowing how to stay healthy.
I don't know what happened in 1990.
So informed consent.
What year was? Do you know what year that was?
That was prior to COVID.
Prior to COVID. Okay, I was curious if it was prior. Or
yeah,
post.
that was. Larry King hasn't been around. Larry King hasn't been around.
I guess that's true.
For a while.
Would have been 4 years ago.
Yeah, it might have been a little bit more than that. But so it's ironic though. They were talking about vaccines are the biggest growing thing, and then they make more money than they ever did.
If they said 13 billion there, I bet vaccines are at like 50. I mean billion. I bet they're like at 50 billion or something. I mean they had to have quadrupled or at least tripled or something.
Yeah, and so again, me and Dr. Roy have gone back and forth on vaccines. He's again a vaccine advocate in a lot of ways. I think he's opened his mind. He saw my kids' vaccine schedule and how quickly he was given them when he was very young. What Jenny said was accurate. I think we should, there's no studies, there's no long-term studies that are done on any of these things as to not only how good, like 29 new vaccines for what, and what really stopped and what chemicals are in those things. We talked about polio and Dr. Roy's like polio vaccine helped get rid of polio. We have a nuanced conversation about that, but the polio vaccine of that day is not the same as the polio vaccine is today.
No.
So,
and I mean, there are a lot of vaccines that these kids don't need, and they don't need them that early.
Are right on top of each other. Like how many at a time?
The pediatricians are trapped. Mm-hmm. They are gold duct tape, gold handcuffed to doing these, because if they fail to do one of those vaccines intentionally, then they could lose their license.
Yeah, we don't have. Was it last week we had on the board? Was it standard of care?
Yes.
Yeah. So basically,
it's the standard of care,
which means if you don't do it, your license can be in jeopardy.
Well, your license can be in jeopardy, but you can also be sued.
100%.
Yeah.
So we need a hard break, but hopefully you guys have checked out some of the notes behind. I don't know that we got to all of those things, even behind Dr. Roy there. One of the things, the last shout out, I want Dr. Roy and Dr. Jack Kruse to have a conversation. I feel like we could really make something cool happen that Dr. Jack hasn't been able to do. I want to also, because Dr. Jack has an ear with RFK. I've got a note over there behind Dr. Roy. It says RFK to Health and Human Services Director, please stop medical tyranny. Please allow doctors to stand up against future COVID and similar antics, and no more using medical boards to silence dissenting voices. No more threatening to take away license whenever someone like Dr. Roy wants to come up and say, wait a minute, this doesn't look right. Because those early signal people are the ones that have to be given friction to everyone else.
Yeah.
That's the only way science works.
Yeah.
Canaries.
We didn't canary in a coal mine for sure.
Canaries in the coal mines.
All right. Well, guys, I appreciate it. I know
Yeah.
we're on a hard break here. Thanks for taking part of your day.
Yep. Back to work I go.
Eating junk food in front of us. Oh, jeez.
It's okay.
Anyway.
All right. Love you guys. Love you all.
Here we go.
Thanks for watching. We'll see you next time. Dr. Jack, reach out to me or Dr. Roy. Let's put something together.
Absolutely.
Sure thing.
Take care.
Thank you all.
Thanks. Bye-bye.